I'm
Yay, I'm
honored.
happy.
I'm honored.
Okay, so we're live casting, but to your point about Cynthia being on the committee now, if you read the bylaws, technically nobody is on any committee at the end of the term, which is the end of this month, and everybody has to reapply.
Including the chairs?
I believe so. That's now, I'm not the one who interprets the bylaws, but that's my reading of it.
Okay, I wasn't aware of that. But anyway, you know, our committee, I feel that our committee has been strong. You know, we've had a lot of good information and presenters, and you know, tonight's gonna be a great night
I
for
have
us.
6
because-
p.m. now, so I need to start the webinar, and hopefully we'll see guests joining us as well.
Okay,
And the recording is in progress. So Shanice Brathwaite, number 2. Do you know how to change your name, or would you like my assistance with that?
I don't think he heard you.
I know. I'm gonna... So our guest, who is not Shanice Brathwaite, but has her name.
Oh, okay, here, right here. I got
You
you.
know how to change your name on Zoom, or
Let
would
me
you like
rename
my
myself.
assistance?
Okay.
Would you like my assistance changing your name, or can you?
Oh, I got
great.
it.
Great,
Yep.
thank you. I didn't hear you properly because I was talking.
Okay.
Cynthia, I have just beyond 6. You can start when you wish.
I see that we have 11 people, so maybe we should do the roll call because we have 2 presenters tonight, and I know that it's gonna be tight.
Great. Thank you. All right, I'm going to mute everybody. And I am going to call the names of our committee members. When I call your name, please unmute yourself, acknowledge your name, and then mute yourself again. Board members who are not committee members, I'm going to write your name down, but I'm not going to call your name. Let's start with Cynthia Gonzalez.
Here,
Thank you. Pat Ruiz. Griselle Amador.
Present.
Thank you. Joan Body.
Here.
Thank you. Cynthia Felix.
Present.
Thank you. Christina Lem. Aurelis Martinez. Dr. Carmen Rivera.
we can't hear you, Carmen.
You're still muted.
Unmute yourself.
It's
She's-
on the
she's
it's on the
trying.
bottom of your screen,
She's trying to find it.
on the left side.
Now, Joan, different versions have it in different places. Give her a moment. Let me see if I can
Okay,
help.
I got it.
All right.
You're
And
here.
are you here?
I'm here.
Thank you. Cynthia, roll is called. Oh, wait, one more. Pat Ruiz. Now give her one moment. She just signed in.
Tonight's her daughter's birthday, so I didn't even think she would make it, but looks like she will.
Her audio isn't connecting or connected right now. So let's say roll is called and I will write her name down.
Okay, thank you so much, Jeremy.
No problem.
Okay, good evening, everyone. Tonight we have the opportunity to discuss healthcare insurance with two organizations that will walk us through the complexities of understanding and applying for affordable health insurance. None of us can live a normal life or a productive life if we or our families are not healthy. And if we are not insured, we face devastating financial expenses that impact the lives of our families. We will hear from Stana Naki from the New York State Department of Health, who will speak about the New York State Health Insurance Marketplace, and from Shanice Brathwaite from Metro Plus Health, who will speak about the services they provide and in conjunction with the New York City Health and Hospitals. Because health insurance is such a complex topic, and in the limited time that we have, each presenter will have 20 minutes to present, and the committee and the community will have 15 minutes to ask questions. I will ask everyone to hold your questions until the end of the presentation. Hi, Pat. We will begin with Miss Nanki. Nanki, I hope I'm pronouncing it the proper way. Hi.
Hello, it's Nakli.
Oh, it's Nakli.
Yes, but that's okay.
New York State of Health is a new health plan marketplace. Individuals, families, and small businesses can use it to buy health insurance. It lets you shop and compare many health plans. It is the only place to get help lowering the cost of health coverage. There will be links to the materials in Spanish, Chinese, and Arabic in the Zoom chat. Miss
Nakli.
Thank you for coming to share this vital information with us. So I'll turn it over to you. Thank you again.
Thank you so much for having me this evening. So I guess I will share my screen so I can go through the slides. Is that how we should do it?
Yes, I have to make you a co-host. Just give me one moment.
Okay.
And you should be able to share your screen now.
Let's see. Okay, do you see my slides?
Not yet.
Now?
There we go.
Okay.
You got it.
Perfect. All right. So thank you again for having me this evening. I'll try to get through this. I have about 23 slides quickly, so we have some time for questions. So my name is Stana Nakli, and I am a regional director from the New York State of Health Small Business Marketplace. And I'm here to tell you about the New York State of Health, if this is something that you are not familiar with. And if you are familiar with, I'm hoping to maybe give you some updates about what the current situation is with health insurance access in New York State, with the goal of, hoping that you can then pass this information to your community members and hopefully learn something new. So let's get started with the slides. Okay, so what is New York State of Health and who uses it? So New York State of Health is the official marketplace in New York State that was basically established by the Affordable Care Act that came about in 2013. A lot of people know it as Obamacare. We don't like to use that term, but that's how it's known. Basically, it's a marketplace. When Affordable Care Act was passed, it allowed states to choose if they wanted to have their own marketplaces or not. Some states chose to run their own, I think about 13 of them in the nation, and New York is one of them. And other states allow the federal government to run it for them. So we have built our own marketplace called New York State of Health. It's run by the New York State Department of Health, and that's who I work for. So the marketplace is basically sort of like an online shopping tool for health insurance. Consumers, individuals, families, working individuals, even small businesses can come to our website and shop for health insurance online. They can look at plans in their area by zip codes, look to see how much those plans cost, look at every single benefit that the plan covers, and compare them side by side. They can also look for assistance with enrollment. They can see if they're eligible for financial assistance, and eventually, hopefully, enroll in a plan that they're eligible and that fits their needs. So Marketplace is open to all New York State's residents who are lawfully present, and there is a lot of categories, in that lawfully present term. I can give you more details, but there is a whole list of what that really means. There is a whole bunch of different visa statuses that are considered lawfully present, as well as US citizens and green card holders and others. Okay, so just some quick facts about New York State of Health enrollment to date. So more than 6.5 million New Yorkers are enrolled in coverage through us. That means about 1 in 3 New Yorkers has coverage through New York State of Health, so 1/3 of the state. Since 2013, so one of the goals, just to back up, of the Affordable Care Act was to lower the uninsurance rates in US. And we have accomplished this since the Marketplace came to be, because the uninsurance rate in 2013 was 10%, and now it's less than 5%. So basically allowing all these new options for people to enroll in, and also offering financial assistance allowed more people to get access to health insurance that previously didn't have it. The uninsurance rate went from 4% to less than 2.4 among kids, and more than 1 million people have gained coverage that previously didn't have it. However, the uninsurance rate is still, around 5% in New York State, and we have pockets of uninsurance that are higher than average, and Bronx is one of those areas. So we are really hoping to kind of focus on the 5 boroughs, and Bronx, Brooklyn, and Queens specifically, to spread the word about New York State of Health, with the goal of getting people to come and see what they're eligible for, that they may not even know about, and eventually gaining access to health insurance. So what benefits are included in New York State of Health plans, and is financial help available? So the Affordable Care Act, it was, amongst many things that it was trying to accomplish, was to make health insurance more standardized, so people could compare plans easily side by side, and also understand what exactly is covered. So what it requires is that all health insurance plans have these 10 what we call essential health benefits categories. They're listed here. And those are categories that within which are many other services that are included in those categories, but they're required by Affordable Care Act, and all the plans have to offer them. There are things here that previously weren't easily available to people, like mental health services or prescription drugs are now included. Pediatric dental and vision wasn't part of all the plans prior to Affordable Care Act. So it's an accomplishment of sorts. So all the plans have these benefits included, and some have some extra even on top of it that, you have to really look at the plan, but every plan will have at least these benefits included in them. So the American Rescue Plan, this is something, if you are familiar with New York State of Health and the Marketplace, and you've heard about it, or you may even be enrolled, this is something that's new, and I really wanted to make sure that I mention it while it's still current. I'm sure you probably heard about American Rescue Plan. It's a stimulus package that was signed into law in March of last year by President Biden, and it had many different components to it, but part of the package also included provisions for health insurance. And basically what it does in a nutshell is, what it did was increase financial assistance that's available to consumers to get for their premiums to get coverage. And this is obviously because of the COVID-19 and the health health emergency that we are dealing still with. So this American Rescue Plan is still going on, it's available, and we are really wanting to make sure that people are aware of it, and kind of visit New York State of Health, at least inquire to see what it's about, and maybe look to see if they might be eligible for financial assistance. So what it did was it increased the amounts of financial assistance previously already available to higher amounts. So people that previously were not eligible for any financial assistance now may be eligible, and those that already had some help paying for their premiums may get more help now. And this American Rescue Plan is in effect till the end of the year. So we want to make sure that people are aware and kind of educate themselves about this. So here's just a little slide that kind of shows you an example. And this is a very low income, but it's just a number to give you an idea. So an individual in New York City earning $35,000 previously was getting $359 tax credit. Now they would be getting $478 under the American Rescue Plan, which means they would be saving money, which amounts to over $1,400 per year. So it's there, the help is available, you know, just make sure that everybody knows about it and checks it out and see what they may be eligible for under the American Rescue Plan. Okay, so our website has a lot of resources, and it's kind of overwhelming sometimes when you first come visit our website. There's so many things there, but there is a lot of useful information there. So what consumers, individuals, families, people looking for health insurance can do before they even commit to enrolling in anything, they can come and visit our website and look to see what plans are available in their area. So all the plans you would be searching by your zip code, because New York State has 8 different health insurance rating regions, and they have different insurance carriers and prices. So you would put your zip code in, and then you would, actually the next slide shows it in more detail. You would choose your county, how many people in your household, adults, kids, and then total household income. And you would just calculate, and this tool would show you sort of an estimate of what financial assistance you may be eligible for before even committing or enrolling in anything. So this is just one of the tools that we have on our website. There is a lot of different kinds of tools like this. So I kind of want to make sure that people, you know, are aware and, you know, visit our website and look at these resources. So when and how people can enroll in New York State of Health plans. Enrollment periods. So generally speaking, there is an open enrollment period in the fall normally. That's November through January. But because of the ongoing health emergency and COVID-19 situation, the open enrollment has been extended, and it's been opened for some period of time now. And it's still extended at least through October 2022 and possibly even longer. We get our guidance on this from the federal government, so we always get updated as they come up with new rules. So right now, the open enrollment is open to everybody until the October 2022. So what that means is anyone looking for health insurance can come in and get enrolled now. Normally that would not be the case because, as I mentioned, the open enrollment period generally is only in the fall for a period of 3 months, but right now it's ongoing and open to everybody. Besides that, some programs that we have like Medicaid, Child Health Plus, and Essential Plan have an open enrollment year-round. So if people are eligible for those plans, they can enroll in those plans at any point. And you know, what determines what plan you're eligible for is always based on your household size and your household income. So once you put that information in, our system will determine what you may be eligible for, what you can enroll in. So this is kind of just a recap. Yes, we are always aligned with the federal marketplace and other state marketplaces in terms of open enrollment. So we are always awaiting a guidance from federal government on whether or not the open enrollment period will be extended past October. Those people that have qualifying events, such as getting married, getting divorced, moving from one state to another, sometimes even from one borough to another. Those are all called qualifying events, and those also allow people to get enrolled in health insurance. So say you lose your job, that will give you a qualifying event to get enrolled in coverage at any point when that occurs, or you move, you will be able to access health insurance because that's considered a qualifying event. So the way we work in terms of enrollment for consumers, it's always on the 15th of the month deadline. So right now, today is the 7th of June. So if I were to go and enroll in coverage, I have all the way up to June 15th to enroll, and my coverage would begin on July 1st. If I miss the June 15th deadline and now say it's June 16th, my coverage then would begin on August 1st, and so on and so forth. It's always on this 15th of the month deadline. So how do people enroll? We were trying to basically make sure that people have all kinds of points of access to be able to enroll in coverage and try to make it easy for anyone. So people are able to enroll online by themselves. If they are comfortable with technology and are tech savvy enough, they can establish an account online and enroll, do the whole application themselves and enroll online by themselves. We also have customer service available 6 days a week in all languages, and they can actually do the entire application for the consumer over the phone. So you will provide all the information about yourself and your family, and they will kind of walk you through the whole process and enroll you on the phone. And then lastly, we also have what we call enrollment assistors, and there are different categories of these assistors. And those are in-person assistors, free of charge, that will basically do the entire process for you. We really encourage people to try to use these assistors because they're trained, they know how health insurance works. It's very complicated. You know, they know what they're doing, and they will just assist you with the entire process and enroll you. And you will always be able to go back to this assister with any questions or changes that may occur in your life. You know, you have a new baby, you will go to your sister, they will change the application, update it, enroll your baby in coverage, and so on and so forth. So about 80 people, 80% of all the consumers that enroll with us use the assister. We have, as you can see, different categories of assisters, and totaling about 7,500 plus assisters throughout the entire New York State. How can I learn more about New York State of Health? So as I mentioned, we have lots and lots of different resources on our website, including all these various print materials, fact sheets, rock cards in all languages. We have 27 languages available, and we are happy to provide this to you if you have an opportunity for these kind of print materials to be distributed in your community. We would be happy to provide anything that you wish in any amounts in any language that we have available, and just ship it over to you so you can then distribute it. You know, I don't know if that there is an opportunity for that, but we would be happy to do that. So this is one of our newest resources that we've built. It's a really handy tool. Basically, it's a provider and health plan lookup tool. So if you are looking, trying to figure out which health plan to enroll with. So for example, you have a doctor that you really like, and you want to see what health insurance plans that doctor accepts. You can use this tool, or you can see which hospitals your doctor works with and accepts. It's very usually you would have to go to every insurance company separately and do this kind of a research by yourself separately. So we basically put all of the information together into this tool, and it's fairly new, about a year old, and it's really the most up-to-date resource that you will find out there for this kind of a lookup tool, for health plans and doctors. So this is what the search tool for assister looks like. If you were to look for an enrollment assister, you would be able to use this search tool on our website. If you already know someone, you can look for them here by their name, or you can look by zip code. You put your zip code and it will give you a whole list of assisters in your area that you can then connect with to see if you want to work with them and get yourself enrolled in coverage. You can, search by various things, counties, languages supported, type of an assister that you wish to work with, and so on and so forth. Almost done. I think there's a couple of slides left. So we are very active on social media, as is the world nowadays. So we try to really, keep everybody updated about every change that happens as they happen through all our social media channels. So you're welcome to follow us on any of them. And if you have any questions, we have a great customer call center. They are available 6 days a week, as I said, in all the languages, as well as our website that has a lot of information on it. And that is it for my presentation. So I'd be happy to take any questions.
Thank you so very much for that. And boy, did you keep right to the point. On time. So at this point, I would like to open it up for questions for Ms. Knackley. And hopefully, we have a lot. I know I have 2 questions, but I'm gonna give up my time for,
Cynthia, would you like me to call on people who have hands raised?
I would truly appreciate that. Thank you so much,
No
Jeremy.
problem. So committee and board members, if you'd like to use the raise hand function, we will call on attendees after our board members. I have Joan Body first.
I want to thank you for your presentation. It was informative. But I'm a little puzzled. And one of the slides, it depends on not only your income, but where you live. Now you're going by neighborhood. Could you explain that to me?
Yes. So basically, there are different rating regions, but New York City is the same rating region. So every neighborhood in the 5 boroughs is going to be considered sort of the same in terms of what's available. So it will be the same insurance carriers that are available with the same rates. Were you to compare that with like, say, upstate New York or Long Island or Westchester region, it would be different. There would be different carriers. But as it pertains to us in New York City, for the 5 boroughs, you will be seeing the same plans, that are available to you. And then, so those are your health insurance plan choices. Then once it comes to enrollment in the coverage, it all depends on the household size and household income. Once you put every member of your family into the system and say what your household income is, our system will basically spit out a result based on what you put in, and also other systems that we kind of run against and tell you, it looks like your family is eligible for, say, Medicaid, or your family is eligible for a qualified health plan, but you are eligible for tax credits. So we will help you pay for some of the premium.
Okay, I got all that, but in reading it and listening to you, I guess I was mistaken in thinking that if you live in, let's say, neighborhood A, and you qualify, and just because you live in neighborhood A, you're going to be denied. That's not true.
No.
Okay, all right.
I
Thank
mean,
you.
no, you
That
can be.
That clears my mind. Thank you.
Yeah,
for-
you can be denied coverage these days because of Affordable Care Act. The main 2 conditions for eligibility are that you live in New York State and that you're lawfully present. If you
Because
fulfill those criteria, then you will be eligible for some kind of insurance.
Okay, thank you.
You're welcome.
That's it.
Thank you, Joan. Cynthia, I have no additional hands up. Stana, I would just like to say, for my office, we would like to get your literature. I have a staff member who usually deals with this and is very good at figuring out the number of pieces we need. We would need in Chinese, Spanish, and English, but I will have Natasha get in touch with you.
Perfect. And I'll send you whatever you ask for.
Great.
Sure.
Cynthia, I have no additional board members.
Okay, but I had a question, because when you listed the covered benefits, right? I didn't see anything for the hearing impaired. So
Yes.
know.
So those were just 10 categories. Those categories have many subcategories. Off top of my head, I don't think hearing aid would be in one of those categories, but those are just the minimum benefits that every plan has to have. Plans also can have additional benefits added to it, things, anything that you can think of. And I'm pretty certain that some plans cover hearing services, but you would have to look through the plans and see, like which plan covers that. So that's basically what you need to look for. You know, like when you look at the plan, it will give you a very detailed explanation of everything that is covered, every single thing. So you will kind of need to search and see which one. And I'm not sure if we have a search tool by specific service like that. But we definitely, you know, list every plan's benefits, and you just need to kind of look through them and see which one covers that specific benefit.
Yeah, because when I didn't see that covered, I automatically thought, what else is not covered, you know? Like there
Well,
are
you
so
know, not
many-
everything is
so-
covered.
Right.
You know, we have kind of two sort of buckets of plans that we offer: standard plans and non-standard plans. The non-standard plans tend to be sort of customized by insurers to offer all kinds of various unusual services. And I would imagine one of those would be having to do with hearing, like for example, acupressure and things like that are included usually in non-standard plans. So it's just a matter of finding a plan that covers it. I don't believe it's part of the standard package, but I will have to double check and get back to you. Just, I don't want to make it up here on the spot, but as far as I know, it's not the standard health benefit, but I will confirm that.
Okay, and the other question that I had was, when you're using the lookup, right? The lookup,
Mhm.
does that include mental health providers as well?
I believe so. That is a specifically built tool. You know, it's kind of like outside of our website, but we build that as an additional resource. It's fairly new. I believe you can actually search by various services. Yes, we'll take a look at it and see what you can do with it. But yes, I think there's all kinds of ways you can search with that tool. So I think you can also search by a specific service.
Thank you.
You're welcome.
And that was the end of my questioning.
So
So,
Cynthia, I will open it up to attendees with your approval.
yes,
Okay. I know I have a question from David Sosa in the chat. I will invite attendees, including David, to raise their hand if they'd like to speak. If David chooses not to, I'll read his question. So David, please unmute yourself.
Hey, good afternoon, all. Just had a quick question. If you had any information about coverage for all, I know it passed in the state this year, and when we can expect the rollout, or more information, or where we can find more information about coverage for all and how we can help folks sign up. Thank you.
I'm not sure what you mean by coverage for all. Are you talking about universal health care, or what do you mean?
Yeah. And specifically it was about seniors 65 and older, for New Yorkers up to 200% of the federal poverty level who are excluded regardless of immigration status.
Okay, I'm not familiar with that. I would imagine that's probably one of the bills that is, the state is trying to. Are you familiar?
Yes.
Yes, you want to talk about it?
Yes. So hi, David. I'm Shanice Brockway from Metro Plus. I was going to come on, but since you asked that question, and I am familiar with it. So the coverage for all that you're specifically talking about, for 65 and older, it's really focused on undocumented immigrants. That doesn't actually start until January of 2023. So while it was introduced and passed in this year's bill that the governor just passed, it doesn't actually roll out until next year. So everything is going to be coming out in phases. So it's starting. You can start to tell your people, you can start to tell the community, those individuals that you service about it, but it's not actually happening at this moment. And when it does happen, it's gonna happen through HRA. It's not gonna be from the New York State of Health.
thank you, Shanice.
No problem.
I'm very excited to hear that. That sounds amazing.
That's helpful. Thank you.
Cynthia, I've run out of hands, and that might be a good segue to our next presenter.
Well, I would like to thank Ms. Knackley for giving us a very, very informative presentation, and We look forward to getting the resources that you're going to bring to the community board, because I'm sure that we will be able to give them out, and people will benefit from this. Thank you
Thank you.
so much for coming.
Thank you so much. I appreciate it.
And now we will hear from Shanice Brathwaite from Metro Plus Health, her colleagues Jacqueline Rivera and Edmund Lee will translate in Spanish and English during the presentation. Since 1985, Metro Health Plus, Inc., a prepaid health services plan, has been offering low or no cost quality health insurance to eligible New Yorkers. Their services include identifying health, mental health, and/or substance abuse needs early, providing support in the home and community, and preventing the need for emergency room visits, hospital stays, or out-of-home placements. Thank you, Ms. Brathwaite, for addressing these critical issues with our community.
Thank you so much. I just want to say good evening to Community Board 7 and attendees. Thank you for allowing us at Metro Plus Health Plan to present for the community of Sunset Park today. My name is Shanice Brathwaite, a supervisor located in the southwest area of Brooklyn. As of June 15th this year, we will have had the honor of serving all 5 boroughs for the last 35 years. Metro Plus focuses on educating, enrolling, and being community focused. We're extremely community focused. It was important for us to present to you tonight in Mandarin and Spanish to be more in tune with the community. Tonight, we have our marketing facilitator enrollers, Edmund S.K. Lee and Jacqueline Rivera, who will be presenting to you on behalf of Metro Plus, our plans, our reward programs, and how it applies to the community of Sunset Park. So Edmund will present. We do have a presentation to share, and he will be presenting in Mandarin tonight.
So Edmund is controlling the deck?
Yes.
Okay, so I'm going to make you a co-host. Give me one moment.
Okay.
And you can now share your screen.
Okay. Let's see. Everybody can see the screen, the yellow?
Not yet.
Not yet. Okay, hold on. Let's
You
see.
need to click on it.
Okay, where about that? Oh. Let's see. It's in this.
So when you hit share screen, you should have a couple of options of which screen to show. Click on the one you want to show.
Okay.
There you go.
Oh, I see. Okay, it's right here. Hold on. Okay.
Now we're seeing your email. You might not want to show us that.
Is this one okay? You see the presentation right
So
now?
I just see a blue background.
Blue background. Oh, hold on. You don't see the deck, the presentation deck. Oh,
No.
I see. Probably like maybe I can do it just by, let's see. I can see it in my screen. But
You have to hit start slideshow.
excuse me?
Try hitting start slideshow, because if you see it on your
Okay.
screen.
All right, let me see. Okay, start the slideshow. Okay.
But if you opened it from your email, you're just gonna see this. You have to download it on your
Oh,
computer.
I see, right here. Everybody see this?
Yes,
Now we have it. Thank you,
Okay,
Cynthia.
great.
I appreciate that.
Thank you.
no worries.
Okay, so everybody can see the screen. Okay, so I got to present it in Chinese. I got it started right now, but presentation's gonna have Chinese and English in some of them. So，我叫李兆強啦，我哋就係代表大都會保險計劃嘅市場代表嚟嘅。咁我哋今日咧就會開始咧就會講一講我哋Metro Plus 咧 ，hopefully 有啲咩服務可以 provide 到，可以俾大家。咁我哋今日咧就會講幾樣嘢嘅。第一樣咧就會講大都會計劃嘅產品啦、服務同埋獎勵啦。咁我哋會有啲乜嘢嘅服務啊、會員獎勵同埋啲額外福利嘅。係啦。咁我哋咧喺 New York 咧喺紐約咧就已經有60萬以上嘅會員。咁我哋個網絡裏邊咧有3萬嘅醫生。咁同埋咧，我哋可以講咧40種唔同嘅語言嘅，係啦。咁基本上咧，大部分嘅語言咧，我哋都會 cover。咁當然啦，中文亦都係其中一樣啦，係啦。咁我哋嘅服務係包括啲咩咧？咁我哋包括咗幾種唔同嘅服務嘅。咁我哋有一種叫做基本計劃 （essential plan） 咧。咁我亦都有啲兒童嘅保健計劃嘅。咁同時亦都有 Medicaid。咁 Medicaid 咧就係俾一啲65歲或者以上嘅老人家可以用嘅，係啦。咁當然啦，咁其實呢啲計劃咧，主要咧就睇翻嗰個申請人嗰個屋企幾多人啦，收入幾多啦，咁同埋咧佢哋本身係咪住喺紐約市嘅，係啦。咁呢個就係最主要幾樣嘢。咁跟住睇我嘅服務啦。咁其實最主要我哋唔同嘅地方咧，就我哋有一個叫360度嘅服務計劃。咁點樣係360度咧？咁其實我哋除咗一啲基本嘅保健計劃之外咧，咁我哋亦都會提供啦好多唔同嘅計劃，譬如有紐約市嘅特別服務啦。咁我哋有啲係俾 LGBTQ 嘅服務。咁同時我哋都有分開咧有HIV 嘅患者嘅服務啦，咁我哋亦都有提供一啲有時我哋基本上都有啲住宿嘅服務都有嘅，咁所以我哋嘅服務範圍咧係360度嘅。咁其實我今晚咧想最主要講一講咧，就我哋一個叫做咧會員嘅獎賞計劃。咁會員獎賞計劃係咩嘢咧？咁會員獎賞計劃就係咧，當你如果係去醫院或者去醫生度做檢查，或者你做一啲打一啲疫苗啊，或者譬如好似最近我哋有 COVID 啦，咁我哋有啲疫苗可以打啦。咁當你做咗呢啲關於同你身體有益嘅嘢、健身嘅嘢咧，咁我哋就會有啲獎賞嘅。咁你就可以咧攞一啲計劃嘅分數。咁呢啲分數咧就可以咧化做一啲錢。咁然後咧就可以喺我哋嗰個計劃裏邊咧可以換取禮物嘅。咁其實禮物方面咧好豐富嘅，咁有一啲譬如話探熱針啦，有一啲醫療用品啦，有玩具啦，亦都有啲日常用品嘅，譬如牙膏、牙刷啊，呢啲都會有嘅。咁好多人咧就發覺原來我喺屋企做下運動，或者去醫生做下檢查，驗下一啲我身體上咧，譬如驗下血啊，做下一啲日常嘅運動啊，咁其實都可以累積到積分而可以換到禮物。咁呢樣嘢咧，其實好多會員咧都好開心嘅。咁我哋亦都咧解釋一下啦。我哋其實好多尤其是新移民咧就會問啦，咁其實攞呢個醫療保險咧會唔會係一種叫公共負擔咧？咁我想話俾大家聽咧，其實醫療保險咧就唔係屬於一個公共負擔嚟嘅。咁因為醫療保險咧係一種最基本需要嘅嘢。咁亦都唔係亦都唔會影響到將來。如果你係想申請一啲譬如話入籍攞綠卡咧，咁亦都唔會受到影響嘅。咁所以大家可以放心嘅。咁同時我有幾個唔同嘅例子俾大家睇下啦。咁譬如話其中一個例子就係阿 Ben 啦，佢本身咧就係攞咗一個叫 B1 嘅 Visa 嘅一個簽證嘅。咁佢就嚟到美國啦，嚟到 New York 咧，就想揾一啲叫健康，即係想申請一個醫療保險啦。咁究竟佢有冇資格申請咧？咁個答案係可以嘅。咁如果咧佢有一個叫做 I-94嘅記錄，而家係未過期嘅話咧，咁佢就可以攞到一個叫 Essential Plan 4嘅計劃。咁 呢個計劃申請咗之後咧，亦都唔會影響到佢第二日想攞綠卡嘅條件嘅，係啦。咁另外一個例子就係話譬如好似 Luna 咁啦，咁佢係一個學生嚟嘅，咁佢咧就有一個叫 F1 嘅護照，咁佢有冇資格申請醫療保險咧？咁亦都有嘅，因為當佢入美國嗰陣時咧，佢有個叫做 I-94嘅入境記錄，如果係未過期嘅話咧，咁佢就可以申請一個基本計劃。咁申請嘅基本計劃咧，亦都唔會影響佢個學生簽證啦，亦都唔會影響到佢將來如果佢想做其他嘅申請，譬如話攞綠卡或者想攞入籍咧，亦都唔會影響到嘅，係啦。咁而家就係一個問答嘅問題啦。咁如果有問題嘅話，我哋可以而家開始嘅。Yes, I just finished my presentation in Chinese. Is there any question people can ask right now, or we can?
So Edmund, I would ask if you could just ask people to use the raise hand function.
OK。如果大家咧係有問題嘅話咧，可以用一個叫舉手嘅嗰個 function 係啦，即係舉手。大家見到喺下邊咧，咁有個叫做raise hand 有隻手嘅，咁呢個係 This is the function. If you see this, you can click on this 係啦，用呢個方法可以問到問題嘅。OK。
I have Cynthia Felix's hand up. Cynthia?
Okay. I see.
Yeah, I want to say thank you for the presentation and especially presenting it in a language that many of our community members will understand. I did have a question about the public charge, and it could be for any of you. Thank you for explaining that, because many of our families are immigrant families and they're afraid to apply for any type of help, whether it's healthcare, etc. So thank you for explaining that this doesn't fall under the public charge, because I think there's a lot of misconceptions that if I do take healthcare, that this will happen.
Yes. I do have I do come across question like this every day. A lot of people come up to me and said, if I apply for the health insurance right now, would it affect me later on for green card or for other status change? So I just want to make sure that this is not public charge, because healthcare is the basic need for everybody, and especially in New York State, this is definitely not a public charge. So I told them not to worry.
And I also had another question about people applying. So I know a lot of agencies move to uploading paperwork through the website. I know, like for SNAP, I was helping a neighbor do it, and all the paperwork is uploaded on a portal. Have you found that to be a hindrance? Because many of our population are elderly or may not be as computer savvy as some of the younger people. Have you found that to be a hindrance? Do you guys still offer in person? Because I know a lot of people was like, no, I'm not going to put my paper through the computer.
Maybe Shanice can address it.
So we have a multitude of ways that individuals can provide their documents. We do offer in person. We're located since the entire pandemic started. Once we were able to come back out, we have been back out in the fields, in the community. We have community offices across the 5 boroughs. We're located in hospitals, settings as well, different facilities and off-site facilities. So individuals have multiple ways of being able to provide their documents. We do use also, New York State of Health implemented a tool that is an app, and it's a simple tool. So we have walked individuals as old as 60 and up, of how to even upload those documents if they're unable to get there. And it's extremely simple to do so. So yes, there's options to bring it in person as well.
Thank you.
You're welcome.
So I guess there's no Chinese question that need to answer.
Not at the moment. One of the great things about us being on YouTube, though, is your presentation, and all of our presentations remain in perpetuity, and folks can view it whenever they wish.
Yes. Okay.
We will make sure that our members know of its availability.
Maybe I can also share my contact here, just in case, if they look at the, they can, right here.
Right.
Yeah, this is my contact here, 917-581-2482。呢個係我嘅電話號碼，可以隨時打俾我嘅，917-581-2482。咁我亦都有個電郵地址嘅，係啦。咁大家可以用呢個電郵咧同我聯絡。咁yes, if anybody in Chinese need to contact me, I can speak Mandarin and Cantonese. You can contact me with this contact. Thank you so much.
Thank you. Would you like to introduce your co-presenter tonight? Behind you.
Yes. This is my son. I'm sorry.
He's a real cutie.
This is nosy boy. He's wondering what's going on here. Okay.
Shanice? Who
Yes.
will be next?
So next person that's going to be presenting is Jackie. I'm actually going to share for her. So Jacqueline Rivera is going to present tonight in Spanish and English.
Sure. Let me just make you co-host and you can share your screen.
Okay.
Welcome, Jacqueline.
There you go.
You're muted, Jackie. Okay.
Hi, I'm Jacqueline. I'm Jackie for short, Rivera. Hola, soy Jackie Rivera.
Can everyone see my screen as yet?
Yes.
Yes, we can.
Okay. Let me just. Okay. Take it away.
Primero de todo, buenas noches. Gracias por permitirnos entrar a sus hogares. Mi nombre es Jacqueline Rivera y trabajo para Metro Plus. Y voy a presentar esta noche. Información de servicios médicos para personas indocumentadas. Personas indocumentadas pueden conseguir seguro médico y pueden llamarnos y lo podemos hacer personal, lo podemos hacer a través del teléfono o viendo a nuestro sitio. Tenemos servicio en la comunidad, en los hospitales, tenemos RV, etcétera, y podemos darles estos servicios. Next slide. The next slide. Ok, esta es la agenda que voy a hablar hoy. ¿Quiénes somos? ¿Qué productos ofrecemos? ¿Cuáles son los beneficios? ¿Cuánto cuesta más o menos? También vamos a hablar sobre Medicare, el Metro Plus Gold y de último, cualquier otra pregunta. Next slide. Metro Plus es más que un plan médico. Nosotros estamos aquí para ayudar a nuestra comunidad. Hemos salido a ayudar a nuestra comunidad, no solamente dando servicios médicos, pero también ayudándole con servicios sociales, la comunidad LGBTQ, también servicios de HIV, buenos para ti, good for you. También atención médica. Next slide. Como podrán ver, hemos crecido, somos más de 600,000 personas que tienen Metro Plus. Tenemos más de 30,000 proveedores y estamos en 40 lenguajes. Next slide. Ahora vamos a hablar sobre los productos que tenemos. Next slide. Uno de los productos que tenemos se llama el plan esencial. El plan esencial cuesta nada. Cuando hicieron esto y pusieron $0 a $20 por mes. Pero ahora mismo, por tener el plan esencial, cuesta absolutamente nada. Lo que tienen que pagar es el copago. Entonces, ahí como podrán ver, el número 1 es una persona. Una persona que no gane más de $25,520, que no cualifique para Medicaid, cualifica para el plan esencial, cuyo es perfecto. Eso cubre dentista, oculista, doctores, etcétera. Y todo Claro está, sin pagar un premium, cuyo muchas veces, muchas personas saben que tienen que pagar una mensualidad todos los meses y después un copago. Pero ahora mismo no hay ningún pago mensual, solamente el copago cuando vas a ver los doctores. También tenemos el programa de Child Plus, el programa de Medicaid, hasta la edad de 64 años. Tenemos también el programa de HIV, también de necesidades especiales, MLTC, etc. Next slide. Tenemos servicios extras para nuestros miembros y eso lo vamos a ver en la otra pantalla que se llama 360 grados. Next slide. 360 grados consiste, bueno, para ti, también tenemos el servicio de enviar las medicinas en paquetes para nuestros miembros. También tenemos el servicio para niños y familias, con programa de envío de pastillas en paquetes, servicios sociales, programas de recompensa que me fascinan. ¿Quién no le gusta ir de compra? ¿Quién le gusta? Suba la mano, ¿quién le gusta ir de compra? A todos, ¿verdad? Déjame decirle, esto es perfecto. Usted, porque cuando usted se convierte en miembro y se une al programa de recompensa, cada vez que tú vas al doctor, cada vez que tú coges el desafío de caminar o el desafío de agua, usted gana puntos. Con estos puntos, tú compras en el lujo de tu casa tranquilamente, tú te metes al internet y puedes comprar 20,000 cosas que te llegan gratuitamente a tu casa. El motivo que hicieron esto fue porque así las personas se cuidan más, están más pendientes a su dieta, etcétera, etcétera. Es una manera de entusiasmar a nuestros miembros de que vivan una vida saludable y por hacer las cosas saludables ganan puntos, como visitar a sus doctores, ganan puntos. A mí me encanta. Next slide. ¿Alguna pregunta tienen ustedes para mí? ¿Alguien tiene preguntas?
Yo tengo una pregunta, pero quiero darle la oportunidad a la comunidad a hacer su pregunta antes. Si hay.
Claro.
If there are no questions from the committee members or the public, I will then ask my one question that I have. No questions?
I see no hands up, Cynthia.
Okay, all right. I'm gonna go because, you know, Metro Plus makes the point that they provide resources to LGBTQ people. So my question regarding that is, you know, it's been in the press very, very much recently about children's gender identity, you know, and I was wondering if you have any specialties in that area where children can go or parents can go to address these issues that may or may not be troubling to those particular families, but because it is so much in the school system nowadays, you know, is there any services for gender identity for children? That's my question.
Ms. Gonzalez, that's a great question. As per what I know, and I can get back to you, we have social caseworkers, social workers that can provide services in general. In regards to LGBTQ, we have programs also that will help the LGBTQ community. You just have to speak with a casework, a social worker, and they can guide you. Mhm.
So social work services is part of the services provided through Metro Plus.
Mhm. Yes.
And how do people access the social work and or mental health services? Do you have like specific sites that they go to, or, you know, how do they access that?
We have services. Shanice, can you elaborate on them?
So Metro Plus, as you know, is part of the Health and Hospitals Corporation. So at the Health and Hospital.
I didn't know that until today.
Yes, we're the Disney, the ABC.
Okay.
That's what we are. So Health and Hospital is our parent company. Therefore, we're aligned with all of the hospitals across the 5 boroughs. What that does is it provides access to a multitude of different services. And one of those services are being able to go to the different facilities and going to see social workers. So like for myself, once upon a time, I worked at Kings County Hospital. At Kings County Hospital, there's the behavioral center. Individuals can come in, they can walk in, they don't have to have an appointment. That allows them to be able to meet with the different doctors that are there, and then those doctors will basically triage and say, okay, these are the services that are needed, and then they will be able to be put in contact with the different social workers that are on site in those buildings. So you know, if you don't want to do it that way, I believe you were asking the question before of how to find different doctors. On our website, we have specialty doctors. It's a filter that you can actually go, you can search providers, and you can bring it down to specialty doctors, and you can look there and find the doctors in your area through your zip code. And we have over 30,000 different doctors that's within our network.
Is Health Plus part of the school-based support teams in the schools?
Metro Plus?
Yeah, I'm sorry, what did I say? I said something
Health
else?
Plus.
Oh, Health Plus, okay, I'm sorry. That
So-
was the last presentation.
If it's part of, in regards to,
Being in the school-based support team, you know,
So-
is Metro Plus part of that, you know, system?
so we work with DYCD. We work within the schools. We know throughout the 5 boroughs with DYCD, we have relationships with different school organizations, parent, counselors. So we are everywhere. Yeah, we have a lot of partnerships, and school is definitely a focus.
Okay. That was my only question.
Okay.
We have no other questions?
I see no additional hands up, Cynthia. Oh, I'm sorry. Hang on. Let me just look at the chat, make sure.
Okay,
Someone wants,
So I think we're all right. Somebody had asked for Edmund Lee's contact info. He gave that.
yes.
There's
Ye-
additional contact info. If you would share that with us as well, we'd be happy.
Yeah, we would love to have a copy of the presentations so that we can disseminate that through our community and our board members that are not part of this committee. And so at this point, on behalf of our CB7 family, we express our gratitude for the valuable information gained tonight. Our Health and Mental Health Committee report will include toll-free crisis hotline numbers to a variety of issues facing many of our families and friends. We thank you so very much, Edmund, Jacqueline, and Shanice. We loved having you, and this has been special. Thank you so much.
Thank you for having us.
Thank you all.
Everybody have a wonderful night and get home safe.
Thank you, everyone. I put my information in the chat box as well.
Thank you.
If anyone wants to get in contact, and you could feel free to share it out.
Great, thank you.
Thank you. Thank you, everyone. Good night.
Good night,
Good night,
everyone.
everybody.
Good night.
Bye-bye.